that if you have a good theoretical understanding of the condition, you can guide yourself through recovery. And it's definitely possible to recover. So don't lose hope, hang in there, and know that it is possible.
Welcome back to another Change the Air Foundation Summit interview. My name is Kendra Seymour, and I'm so excited today to be talking with Dr. Sandeep Gupta about different types of mold-related illnesses because it's more than an allergy. So thank you so much, Dr. Gupta, for being here.
Very welcome, Kendra. Excited to speak to you today.
Yeah, and I'm excited for a few reasons. One of the things that I learned about you not that long ago is your story actually, you were impacted personally by mold and water damage. And I think it's part of what has led you down the path that you're on and has resulted in you creating some truly wonderful resources and, treatment options for your patients. So I just, as somebody who is impacted by that, I want to thank you for that. But there is something so powerful too about when a practitioner kind of has that shared experience with an illness. I think it really helps a patient to feel seen and understood and heard. So they want to hear from you and not from me. So I'm going to let you jump right into your presentation because I know there's a lot you want to share with us today.
Yeah, okay, let's jump into it. Really, I wanted to talk a bit about the different types of mold-related illness because I guess the first key concept is there isn't just one form or one manifestation of illness due to mold. And I've used the UK and Australian spelling here, but at other places I'll use the US spelling just to be fair to everyone. And so many people, particularly in the medical field, mainly know about the allergy form of illness due to mold. But I'm going to cover some of the lesser known and very important forms of mold-related illness so everyone can just be aware. And of course, one of the key concepts is that you can have one or more forms of mold-related illness occurring simultaneously. So there's nothing to say that someone couldn't actually have a component of all four going on. Generally speaking, someone will have one predominant form, and in terms of the medical side of it, that's what we then focus on, and if we have to give it a name, we usually use the name of the predominant illness that's manifesting, if you like, or the predominant form. So the basic premise, and I'm sure this has been nailed down and hammered into everyone during this whole summit, but mold and dampness are extremely common causes of illness that are usually neglected at great expense to the patient. So in conventional medicine at the moment, it's this cause of illness still hasn't really made it into the textbooks at medical school yet. And so currently it's considered by most doctors and specialists and so on that it's actually the opposite, that mold and dampness are very rare causes of illness. And we're hoping that this paradigm will change over the next 10 to 15 years with more research and more teaching coming out on this subject. But I think if we start with the premise that it's extremely common that they are related to illness in some form or shape, particularly when we're talking about chronic illness. Okay, so jumping straight into the main different forms. So firstly, allergy related. So generally speaking, if someone's experiencing allergy-related symptoms, it's going to be single system. So therefore, it'll generally only affect one or two systems of the body. So often it will be, lung or sinus related. So classic things would be like a runny nose, sore throat, a little bit of wheezing. And sometimes it can involve the skin as well, with a bit of skin itching or wheals, what we call urticaria. But generally speaking, it doesn't involve a whole lot of other body systems. In some cases, it can be more severe and you can start getting other symptoms with it. And there can be a crossover with what's called mast cell activation syndrome, in more severe forms of allergy related. But by and large, it tends to be mild to moderate and mainly involve the respiratory system. Now, secondly, infection. so what's called mycoses, so infections with fungi, referred to as mycoses, and colonization. So what's the difference between infection and colonization? I guess infection is where the organism is actually causing illness and invading tissues, and colonization is considered to more be where you have an organism which is just acting as an innocent bystander. And the terminology can get a little bit confusing at times, because generally many medical doctors kind of think of fungal infection only when you can pick it up in the bloodstream, or pick it up on cultures, which only generally happens in very severe cases. So we sometimes use the term colonization, while just to differentiate it from more of a life-threatening infection, but in reality, probably infection is the correct term. So infections and colonization can be single or multi-system. So for instance, if you just have a localized skin infection with a fungus, then that's more single system. But that also can be an indication that there's a whole body or systemic issue with mold or fungus occurring. Now, thrush is a form of candida infection in the reproductive area. And so although that's not directly mold, so yeast are a different form of fungi to mold. They're single-celled fungi. However, there is an interplay here, let's say, between mold exposure. You can also get yeast in a water damage building. So it's possible to get yeast like candida and geotrichum and other types of yeast. However, if you get exposure in a home to mold and dampness, you're more likely to get yeast infections as well. So just to be clear here, I'm not saying that candida is a type of mold, but there's a big interplay. So systemic candidiasis is where you get a much more severe overgrowth of candida, and which basically starts invading other tissues of the body, and in very severe cases gets into the bloodstream. Now, an aspergilloma is where you have a localized infection with a mold species called Aspergillus, and that can be in the lungs or sinuses. And then you can just have aspergillosis in general. So aspergilloma is kind of where you have a localized ball, and aspergillosis is basically where you just have an infection with the mold species Aspergillus, and that can be in the lungs and the sinuses most commonly, and rarely in other tissues. And then you can have in what's called invasive fungal rhinosinusitis. Sorry about all these complicated terms. I don't know why we don't make it simple. But basically, rhino means the nose, and obviously sinus refers to the sinus cavities. So when we say rhinosinusitis, we mean an inflammation of the nose and sinus caused by a fungal infection. And so when it's invasive, it means it's affecting the deep tissues. Very severe cases, a fungal rhinosinusitis can actually get into the brain, cause brain abscesses. That's been reported in the Indian Journal of Neurology. So it is very, very important to know about it. Generally speaking, ENT surgeons don't look at this very much. And one reason for this is that many of the studies found that normal controls also have a very high level of fungal, a high incidence of fungal on their sinus cultures. And so cases of chronic sinusitis didn't have a huge difference in the amount of fungus showing up. And therefore it was considered that, okay, well, that's more just colonization. However, it's one of those tricky things where, and certainly my experience has pointed to the fact that in certain cases, the fungus that's showing up becomes more active or becomes more pathogenic. And in other cases, there can be fungus present which hasn't become active. So that's kind of one point of confusion. Then you can also get it in the gastrointestinal tract, what we call fungal dysbiosis. So dysbiosis means an imbalance of organisms. So it's normal, by the way, to have a certain degree of fungus, or particularly candida, in the gut. However, we call it candidiasis where it's overgrown. It's gone out of balance. And the term SIFO is small intestinal fungal overgrowth, basically where it's based in the small intestine. and the fungus has started to overgrow. So it can be in many different organs of the body. So it can be lungs, sinus, bladder, and gut are the most common ones. Then moving on to direct toxic and metabolic effects of mycotoxins. So this is different to allergy and it's different to infections. It's where the mycotoxins, which are the toxins produced by mold species. So probably the most common one is ochratoxin A, which is mainly produced by Aspergillus species. It's where a mycotoxin like that. So ochratoxin A, for instance, is known to be toxic to the kidneys. So that's an example of where you're getting a direct toxic and metabolic effect. So this can happen through ingested or inhaled mycotoxins or from fungal colonization. So another example, there was actually a paper recently published, which showed that certain mycotoxins, such as ochratoxin again, and T2 toxin, which is a type of trichothecene, and there's another one called vomitoxin, it's another type of trichothecene, have direct neurological toxicity. And they found in one of them, one of the toxins, it actually affects the dopamine system of the brain and can cause a Parkinson-like situation. So that's a more severe direct toxic effect of mycotoxins. And there's many other organs which they can be toxic to. So we've talked about the kidneys and the brain, but certainly liver could be one of them, pancreas could be one of them, lungs. So in certain cases, they can affect many different organs. Now, the testing can be via urinary or serum antibodies for mycotoxins. So when you're looking at urinary mycotoxins, in general, you're just looking at what's been excreted at any one time. If you, however, provoke the urinary mycotoxin test, which is generally recommended more with the real times testing rather than Great Plains, you may then get a more accurate measure of how much how much the total body burden is, which is really what you're wanting to know. Now, the serum antibody mycotoxin testing, which is mainly done via MyMyco labs in America, that's giving you an indication of what the immune response to mycotoxins is at any one time. And it can give you an indication as to whether there is a current problem, with reactivity to mycotoxins. So, and then there's other testing that you can do, looking for the actual mold or fungus in the body. So organic acid tests can be very helpful. With the organic acid test, particularly the one by Great Plains Labs, you can see a number of different effects. So one thing is, actually, there's a number of markers which are for fungal colonization. I believe it's the first 12 markers. Now, there's also a marker for oxalates. Oxalates are a crystal-like compound which get produced by fungi when they're colonizing the body. So if you've got oxalates, that can cause problems with the kidneys and bladder, and they can just affect the mitochondria in general. And oxalates tend to reduce the amount of calcium, magnesium, and sulfur in the body. So they can cause deficiencies as well. Now, there's also then a range of different nutrients that are checked. And one thing I have seen with direct toxic and metabolic effects of mycotoxins is often there will be B vitamin deficiencies. If someone has had a lot of mycotoxins in the system, it'll often take out the glutathione. And then you can also get secondarily a salicylate intolerance, and there is a marker on the organic acid for that. And that seems to be because the glucuronidation pathway gets blocked up, because that's the main detoxification pathway for excreting mycotoxins. So there's actually a whole range of different direct toxic and metabolic effects that can occur. And then finally, we've got like more of a whole body inflammatory effect, which is where someone has a multi-system illness, and they can be moderate. It can be a moderately severe thing to, very debilitating. Some people are bedbound with this type of illness. This can be due to inhaled mycotoxins and other biotoxins from water damaged buildings, babesia, stealth infections, etc. And basically, someone with that doesn't just come in and say, I've got a little bit of a cough, or a runny nose or something like that. They more say, I'm dying. I've got fatigue, I've got anxiety, I've got abdominal pain and constipation, and I've also got skin symptoms, and my joints and muscles hurt. And most doctors at that moment start feeling very overwhelmed and start going down the path of depression, because up till this point, there hasn't been good teaching at medical schools about multi-system inflammatory illnesses. Especially, so often what will happen is they'll go and test you for the more common connective tissue diseases and autoimmune diseases, things like lupus and rheumatoid arthritis, etc. And so most doctors are familiar with those type of inflammatory conditions. But if the tests all come back normal for them, generally speaking, they then think, well, this can't be a physical thing. It's got to be psychiatric, and they generally go down the depression and anxiety pathway, because they're not aware of the potential for mold and dampness in a building to cause a whole body inflammation process. And that's one piece of literacy that really needs to get out there in the medical world, and we're working very hard to do so. So the testing for this condition includes the visual contrast test. We'll talk about this a little bit further. There are specific blood biomarkers, which include C4a and TGF-beta and MMP9. Then you can do what's called a volumetric brain MRI scan with a piece of software called NeuroQuant, which can be very useful. And then there's HLA testing for the genes relating to HLA. There's also more advanced gene testing you can do with Bob Miller's system, but the basic one is the HLA. And then there is a transcriptomic test called Genie. And then you can actually you can also add in the other tests as per the previous areas or the previous types of mold illness, because as I say, there can be more than one happening at one time. So often people who have CIRS, they also have an abnormal mycotoxin test, and they also have an organic acid test, which is abnormal, and they may show signs of fungus on various cultures and so on. So I'm gonna jump through this reasonably quick, because I think I'm already at the 20-minute mark. So I've given an overview, but I'm just going to go very quickly through some more specifics. So it's somewhat recognized in mainstream medicine that mold exposure can cause or exacerbate allergic rhinitis, which is hay fever, basically, asthma or wheeze, atopic or contact dermatitis, which is basically like eczema, or atopic dermatitis is eczema, and then hypersensitivity pneumonitis is what we call farmer's lung, where farmers have been inhaling basically mulch or compost, which is infested with mold. There's just a few interesting bits of research that have come out recently. This was a meta-analysis, which is considered to be the highest form of research in medicine, looking at indoor dampness and mold and rhinitis. And they looked at a number of different studies which investigated the risk of different types of rhinitis and whether they differed according to the type of exposure. And basically, the meta-analysis provided new evidence that dampness and mold at home are determinants of rhinitis and its subcategories. Particularly, the association was strongest with mold odor, suggesting the importance of microbial causal agents. So where there's smoke, there is generally fire. So if you've got a significant musty odor in a building, there generally is I do find that correlates very well with there actually being water damage and microbial contamination. And they stated that our results provide evidence that justifies prevention and remediation of indoor dampness and mold problems, as such actions are likely to reduce rhinitis. I don't think the study has made it into the ENT fraternity as yet, but it's definitely a very interesting one that is really very high quality evidence to suggest that there's a connection between hay fever and other types of nasal inflammation and mold exposure. Now, this is a New Zealand study where they looked at the quality of homes, and they found that leaking in moldy houses could lead children to develop asthma. And basically, this study looked at 150 children who visited GPs for their first prescription of asthma medication, which could be Ventolin, with 300 controls who had never experienced wheezing associated with asthma. And the main researcher, Dr. Shorter, said that while it had been known that dampened mold could make asthma worse, this is one of the first studies that showed it might actually be causing it. And they found that mold and leaks were much more likely to be found in the bedrooms and homes of children who had just started wheezing compared to the children who had never wheezed. So that's very, very important research. And, basically the importance of being in a mold-free building for children can't be overestimated if you want them to have a childhood that's free of illness from asthma and also things like frequent infections and so on. Now, this one looked at prenatal mold exposure. So if the mother and father are getting exposed to mold before the child is born, there seemed to be an a risk rather, with the development of atopic dermatitis or eczema in infants through allergic inflammation. So jumping through here to the conclusion, they found that the indoor mold exposure during the fetal period was associated with the development of atopic dermatitis via IgE-mediated allergic inflammation. So that's basically the normal form of allergy. And they found that avoidance of mold exposure during this critical period may prevent the development of atopic dermatitis or eczema. Fourthly, there was a interesting study out of Manchester in the UK, where they looked at 140 people with chronic obstructive pulmonary disease. So that's basically emphysema rather, and chronic bronchitis, which is often related to past cigarette smoking, but there are also rare genetic causes. And they basically looked at self-reported exposure to mold using a questionnaire. And while that's not quite as accurate, it's like, for instance, looking at an actual inspection of a home, it seems to still be reasonably predictive. And they found that they were four times more likely to visit a GP for chest problems if they vacuumed their home more often than once a week. So that's interesting. And that makes you question whether people who are just a bit hyper vigilant to their home and cleanliness issues may also be more likely to develop these problems. And in addition, current or previous occupational contact with agricultural resources also increased the risk. So that one certainly seems to be related to exposure to environmental factors for sure. Okay, how are we going here, Kendra? Do you want me to just keep thinking through?
If you have time, keep going. This is really fantastic.
Okay, cool. So jumping into fungal infection or colonization. I'm sure many of you have seen a tongue like this before. And the key is that any type of fungal infection, whether it be on the tongue, whether it be in the lung, etc., that may be an indicator of systemic infection. And so fungal infection or mycosis, although mentioned in mainstream textbooks, is rarely recognized and diagnosed in the conventional medicine world. So that can involve skin infection, things like athlete's foot, ringworm, jock itch, etc. Mucosal overgrowth of fungus, so that can be oral, vaginal, penile thrush. Then our favorite term, fungal rhinosinusitis. Haven't tripped over that one yet. I usually do. And then we've got aspergillosis or aspergillomas, which you all know what that is now, and systemic or invasive candidiasis. Then there's also a type of fungus called Cryptococcus neoformans. Now, Cryptococcus often overgrows in patients who are immunosuppressed, which means their immune system has been lowered either by an illness or by the medications that they're receiving. So particularly like cancer patients who are on chemotherapy or HIV patients, etc., tend to get that. And then there's another one called mucormycosis, which was reported during the COVID-19 pandemic, particularly in India, that patients were developing mucormycosis. So there's one type of mold called mucor, and that can also cause a very severe form of fungal infection. So as we say, it can go all the way from something that's just mildly annoying to something that's life-threatening. So this toe here is showing an example of fungal infection of the toe, and you can see the cracking and the discoloration. Now, generally speaking, this is an indication that there is a widespread fungus colonization in the body that needs to be addressed. It's not just in the toe. So moving on to gastrointestinal or nasal colonization. So symptoms of nasal colonization can be, nasal congestion would be one of the most common ones. A runny nose, post-nasal drip, which is really when you notice there's something dripping down the back of your throat. It can be quite subtle. It happens more when you're lying down, and often that will trigger a cough. And then sinus pain or headaches is another one. Now, it's important to know that chronic sinusitis can be totally asymptomatic. It can just be picked up on scans. Now, you can diagnose this with a nasal swab or culture, and one that we use quite a lot is Microbiology DX, who grow their culture for many, many days. I think it's at least 5-6 days. And then using nasal, herbal, or pharmaceutical antifungals can be the treatment. You can use colloidal silver. You can use iodine. There's a variety. You can also use nasal herbs. So there is a variety of different things that can be used to treat this. One thing that I have used, particularly when people are showing aspergillus, or what I've seen quite a lot of is rare types of candida recently in coming up on nasal swabs of people who have nasal symptoms, and sometimes they need like a nasal amphotericin prescription for a nasal spray, and in those cases that can be very, very useful. Now, talking about GI colonization or infection, you can get bloating, gas, diarrhea, constipation, gastroparesis, stomach pain or abdominal pain in general, and SIFO symptoms, which basically are the bloating and gas or diarrhea and constipation. So you can diagnose that using a stool test. Now, particularly using stool tests that are based on PCR or DNA identification are more likely to show it, but it can also show on culture-based testing, especially if they culture the stool for quite some time. And then the organic acid test, again, markers 1 to 9 are thought to be indicative. Look, they're not absolutely diagnostic, just to be clear on that. They're just possible indicators. There are other things actually that can raise those markers as well. And the treatment is herbal or supplemental antifungals. So natural antifungals, I guess, is another way of saying it. And there's a number of those. So, for instance, powder arco, caprylic acid, golden seal, reishi mushroom. There's a whole range of other ones. Olive leaf is quite useful. And then pharmaceutical antifungals. One of the most common ones would be itraconazole. There's also fluconazole can be used. And then, being on a low mold and yeast and sugar diet is very important, because in general, there will be some effective diet. So in general, just to mention this point, yeast such as candida will tend to be mainly diet related with a minor influence from the environment, and mold colonization tends to be mainly environmental with a more minor influence of diet. But I do believe there is an influence either way. And it's important to be careful with the diet and be on a really, generally a gluten-free, dairy-free, sugar-free diet, at least initially, and then slowly you can reintroduce some of those foods. So it's much more common for infection or colonization to be mild and to involve multiple organs, such as the small and large intestines, lung tissue, rhinosinus area, reproductive organs, and skin. So pretty much anyone who's had severe mold exposure, if you check them, and use energy medicine and so on, you'll find that they do have a mild degree of fungal infection and colonization showing up. So this is an example on the organic acid test with Great Plains Lab of the fungal colonization markers. So in this case, citramalic acid and arabinose are both elevated. So arabinose is thought to be more a marker of yeast, and the citramalic is a more general marker. It can indicate aspergillus in some cases. So the more accurate ones are thought, the more predictive ones are thought to be what we call the furans. So that's markers 2, 4, and 5. However, the other ones are also, can also be predictive in some cases. Now, in this particular case, there was also an increase in oxalic acid or oxalate. And so, putting people, at least taking them off the really high oxalate foods like spinach, beetroot, and chard is really important, even though it may not be dietary. It may be 100% due to a fungus in the body, but still just avoiding, adding to it by dietary oxalates is very important. Generally want to limit vitamin C to only about 500 milligrams a day. And succinic acid is very, very common with mold and dampness it's very, very common to have it elevated rather. And that can also indicate a deficiency of vitamin B2. And then in this case, we've got an elevation of ketone and fatty acids. And so if the person's not on a if they're on a ketogenic diet, then it's actually pretty normal to see these markers up because the person's actually trying to get ketone bodies up. But if they're not on a super high fat diet, then this indicates that there's a deficiency probably of carnitine and B2, which is another metabolic effect of mycotoxins I see quite regularly. And then, we see here, we've mentioned B2 a couple of times. So the elevated level of this glutaric acid indicates that the B2 levels are functionally insufficient, and that may be having an effect on glutathione. So you need B2 to keep the glutathione in the reduced or antioxidant state. If you don't have enough B2, it tends to get oxidized and not be able to be recycled, and therefore you need more glutathione. So jumping a bit more into the treatment, and I've mentioned this already, there's a range of different herbs, as already mentioned, reishi mushroom, powder ako, golden seal, and olive leaf. Antifungals are needed. So nystatin is the main one, which is used for yeast. Also fluconazole is used for yeast. But the other azoles, such as itraconazole, posaconazole, and voriconazole, are used more for mold, such as aspergillus. And amphotericin B in a nasal spray is also commonly used for mold infection or colonization of the nasal passages. Avoidance of water damaged buildings. I mean, it can't be emphasized enough. And I always go back to that. Even when we're talking about all these other treatments, always think of this and focus on this aspect if you want good results. So let's say you have someone who's in a really water damaged building and they've got fungal colonization. You can by all means do all of this, but if you don't address this, it's likely that the infection and colonization will keep coming back. So I'm not saying just treat them by any means, just treat them with antifungals or herbs, but it's good to have these treatments available. But the key is you've got to get away from the cause. And then local treatment can be quite helpful. So nasal sprays, if there's nasal colonization, vaginal douches, and topical creams for the skin, which utilize antifungal medications or herbs. All right, let's jump into direct and metabolic effects of mycotoxins. So what exactly are mycotoxins? They are the toxic secondary metabolites produced by fungus. So they're small molecules which have a low molecular weight, and they're thought to act as a defense mechanism against bacteria, other fungi, and insects. So fungi in nature defend themselves against other invaders. Some mycotoxins have been used in medicine, so they can be very potent. Penicillin is obviously from the mold Penicillium. Mycophenolic acid, I believe, also comes from Aspergillus and Penicillium, and cyclosporin has also been related to various mold species. So up to now, 300 to 400 have been discovered to date. Aflatoxin here in the diagram has been linked to liver cancer, particularly in Africa, in people eating a lot of contaminated peanuts. Ochratoxin A is probably the most common one you'll see. Which is related to aspergillus, related to kidney problems and gut problems and so on. Fumicin B1 is very important. Deoxynavanol is the same as vomitoxin I mentioned before. It's a type of trichothecene. Patulin is very important. Zearalenone is related to a type of mold called Fusarium. And citrinin is related to multiple different mold species. It's not specific to one. So how do mycotoxins enter the body? So the mainstream literature mainly talks about food contamination via the GI tract, and it tends to be an issue mostly in developing nations, but when we're talking about massive contamination, but it's also a problem with just mild levels. And anyone who's got a mold-related illness, you want to be careful about, basically chocolate, nuts, grains, corn, coffee, spices, etc. All of those can be subject to contamination. You can also get mycotoxins via inhalation and dermal, which means the skin, and also via the tear ducts, interestingly. And these are generally routes of exposure from water-damaged buildings, or it can be also agricultural. I have had many patients who, for instance, have inhaled a lot of fungus via mulch and compost, and that's more associated with chronic illness. So mycotoxicosis means a poisoning of the body from mycotoxins, poisoning by natural means. So acute mycotoxicosis is rapid onset. There's an obvious toxic response to a massive exposure, and the symptoms can be gut symptoms, nausea, bloating, constipation, and diarrhea, and then neurological symptoms such as a peripheral central neuropathy, but that often means weakness and pain in the nerves, and seizures. Very rarely death has been reported, but that's going to be an extremely massive poisoning where something was just, absolutely packed with mycotoxins, and often in a third world country. Now, chronic mycotoxicosis can feature a range of different symptoms, such as gut symptoms, nausea, bloating, and diarrhea, fatigue, poor sleep, insomnia, unrefreshing sleep, neurological symptoms such as brain fog, memory issues, headaches, and neuropathy once again. And then immune suppression, so frequent colds and flus, frequent fungal infections, hormone imbalance, particularly elevated estrogen levels, and all of the different conditions which go along with that, including fibroids and ovarian cysts and endometriosis. Kidney toxicity, I mentioned with ochratoxin, birth defects, and cancer. So there is evidence that mycotoxins are actually mutagenic, which means that they induce actual DNA level mutations. So it is very, very important to be aware of mycotoxins and their direct and metabolic effects. But the diagnosis is usually via urine mycotoxin testing. So Great Plains Labs is we've discussed already. Real-time labs is another one which uses ELISA rather than the mass spectrometry. MyMyco Labs uses ELISA to check for serum mycotoxin antibodies. The organic acid test we've already discussed with Great Plains Laboratory, and then stool analysis with the GI map testing, which is PCR. Bioscreen is mainly a test available in Australia, and GI 360 is the test done by Doctors Data, which is available in the US and around the world. This is an example of a urine mycotoxin test. This is very common. You'll often see a small amount of ochratoxin on almost any test. But when it's getting above 8 or so, it may be approaching significance. Mycophenolic acid is another one that's very, very common. But when it's getting up towards 100, that suggests that there is more than one would expect, just with incidental exposures to mold. Now, zearalenone is another one that's very important, can be related to corn and other contaminated foodstuff, but also water damaged buildings. So that's very elevated. Once it gets right above the 10 there, that's starting to look elevated. And the citrinin in this case, I would say is pretty minor. I think that's that level of less than 10 is probably not something that's that significant. However, if you repeat the results, often you'll see if something's just very minorly up like that, and then you repeat them in future tests, you'll often see that starts to come up. And the other ones which were massively elevated eventually with treatment start to go down. So the body excretes mycotoxins in layers. So the treatment is a low mold diet and low sugar diet. Removal from water damaged buildings and locations. Of course, that's key. You've got to get away from the Got to get away from the source. There's no, otherwise what you're doing is you're just paling the water out of a boat, but it's the boat's still got a leak in it. So you're still going to sink, basically. You've got to fix the leak, and then by all means start paling out the water and doing all these other things. So antifungals are important if colonization is present. Binders are extremely important to basically block the enterohepatic recirculation of these toxins, which means that the enterohepatic recirculation means that, generally what happens with mycotoxins is they get excreted through the liver and into the bile, but then they often get recirculated back into the intestines again. Now, if you have binders, now cholestyramine was the classic one which was studied, they latch onto the mycotoxin and take them out into the stool. So they stop that recirculation from happening. Now, inflammation reduction is also really important. So the diet, basically avoiding obviously molded or rotten food is very important, especially important for uni students. Nuts can be a problem. Peanuts, pistachios, cashews, walnuts, etc. Particularly cheeses in general, but particularly blue cheese and Stilton. You should definitely seek out a mycotoxin-free coffee. And there's about 3-4 brands out there which are mycotoxin-free. Various grains can be a problem, including corn, wheat, rice, and oats. So you want to just go for non-stored grains. So things like quinoa and buckwheat tend to be more safe, even spelt, if you're not totally gluten intolerant. The dried fruits and dried spices can be an issue. Apple juice, conventionally farmed dairy, meat, and fish, often due to the moldy diet. Processed and smoked meats can be an issue. Mushrooms, when we're talking about button mushrooms, not medicinal mushrooms. Medicinal mushrooms can be extremely helpful. And then yeast, white vinegar, and fermented foods, as well as other fermented kind of alcohol, such as beer, wine, cider, rum, whiskey, gin, and brandy. And then sugar, honey, maple syrup, and other high sugar foods. So I've mentioned this already, but going through it, biotoxins are generally released via the liver, via the bile. And so what happens is ingesting the binders, which are represented by these little stars, leads the binders to bind with the toxins and to excrete them in the stool. Now, without the binder, they get recirculated. All right, I know this is a lot of info, guys, so I'm going to run through this quickly. The main binders that are available are cholestyramine, which is commercially available as Questran or Questran Light, which does have aspartame in it, or compounded, which is generally recommended without fillers or artificial sweeteners. So basically, it's technically known as a bile 50 years ago to lower cholesterol. It's often used after stomach surgery as well to bind onto the bile so people don't get diarrhea. The dose is classically is 4 grams 4 times a day as per the Shoemaker research team, but with sensitive people, it's much better to go for a quarter, even 1/16 of that dose. So, it can be like 0.25 grams twice a day or something like that. And you can always build up from there. You don't want to get a bad reaction because the possible side effects include abdominal pain, bloating, nausea, and constipation, and also reflux. So, and as I say, you may need to start at a much lower dose. Tends to bind a bunch of different mycotoxins, including ochratoxin, fumicin, zearalenone, also endotoxins, pesticides, and cyanobacteria. Colicevalam is kind of a similar medication. It has a similar action to CSM, but it has much less side effects. So it's gentler and better tolerated than CSM, but it can theoretically have similar side effects. So generally, 2 625 milligrams tablets, 1 to 3 times a day. So it's available as Welchol in the United States. In many other countries, you can just get it compounded. I believe it's got a different brand name in the UK. Now, then we've got natural binders. So activated charcoal is used in the emergency room in cases of poisoning. So it definitely has very strong binding effects. There's no doubt about that. And it's in the literature in terms of mycotoxin binding. So a dose of 500 milligrams to 2 grams, 1 to 4 times a day on an empty stomach. But generally 30 to 60 minutes before a meal or 2 hours after food. You want to have them well away from food so they're not binding the food, and away from medications and supplements. So cholestyramine particularly is an issue if you're on thyroid medications or warfarin. You would need to discuss that with your doctor. The possible side effects are less than cholestyramine and Welchol, but can include abdominal pain, bloating, etc. Now that one binds aflatoxin, fumicin, deoxynivalenol, trichothecene, zearalenone, endotoxins, and pesticides. So you'll notice there's a slightly different range of activity for each of them. And that's why it's not a bad idea to have a mix of different binders, especially if you've got a mix of different mycotoxins in your system, which most people will have. It's very rare that it's just 1 or 2 mycotoxins. It's much more common that it's a range of different ones. So bentonite clay, you need to make sure you're getting like a high level bentonite clay or charcoal. That's the other thing to mention, because if you just get a kind of a bottom shelf one from the health food store or Walmart or whatever it is, they may already be bound to heavy metals and other toxins to a certain degree. It's very important to get good brands. So we like MediClay FX from Premier Research, and so 500 milligrams. Yeah, you can eat once or twice a day, but you can certainly go up to 6 of the 500 milligram MediClay capsules a day. And the big side effect would be constipation. Quite rare to get those other problems. You need to make sure you drink a lot of water on any of the binders, and they're going to cause a lot more problems if you're dehydrated. Again, you need to take it well away from medications and supplements. And as you can see here, aflatoxin, fumicin, deoxynivalenol, ochratoxin, T2 toxin, stragmaticin, zearalenone, pesticides, and BPA. So that they all have a slightly different range of activity. So if you actually, just as a matter of interest, the combination of bentonite clay and activated charcoal will bind almost all the mycotoxins which have been described. So that's a good combination. Chitosan is a natural binder derived from shellfish, kind of like a natural version of cholestyramine, and microchitosan is more potent. So probably not compatible with vegetarians and vegans. If you the dose is 500 to 1500 milligrams, 1 to 2 times a day, and away from medications and supplements. Look, you can occasionally get GI side effects, but they're quite rare. The range of activity, I think, is more similar to bentonite clay. Zeolite, again, that's another clay. It is sort of similar to bentonite clay, but it has some differences. One of the differences is it binds histamine. So those with mast cell activation, this may be the preferred binder. The dose is 500 to 3000 milligrams, 1 to 2 times a day. Can be taken with or without food. I would say gut side effects are very rare with zeolite. But like any supplement, there's always some people who react to it, but it's quite rare. And then again, you can get absorption of nutrient supplements and medication, so it's important to take it away from the other supplements and medications, unless they're binder medication. Now, if you've got other binder supplements and medications, you can take, as far as we can see, you can take them all together at one time. They do not seem to bind each other. Probiotics also have some binding activity, which is very interesting. So lactobacillus species such as Plantarum, pentosus, and Breviaris can be useful, and Saccharomyces boulardii, which is actually a yeast itself, can be useful. Occasionally GI disturbances, but very rarely. Can be taken with or without food. Usually last thing at night is a good idea. And they can bind aflatoxin, ochratoxin, trichothecene, zearalenone, and endotoxin. I mean, you would never really use these on their own, but it's just additionally it may have some benefit, and particularly for gliotoxin, I found, even though that's not listed here. But Saccharomyces boulardii can be quite helpful for gliotoxin. And same thing for glutathione or NAC. If you can get the liposomal S-acetyl or IV versions, it's more likely it's going to be well absorbed when we're talking about glutathione, that is. NAC, you can take 500 to 2,000 milligrams. So it can sometimes trigger a detox or a healing crisis, and it's not tolerated by all. So if you've got sulfur reactivity, that can sometimes cause the symptoms of that to be triggered. So aflatoxin and fumicin, and also gliotoxin, sorry. The NAC is often used as part of the treatment for gliotoxin. Okay, some foods also have a slight bile binding capability, and I think the most high is okra. It's used in certain different cultures quite a lot, such as Indian food. Beetroots, asparagus, eggplant, carrots, green beans, cauliflower, kale, Brussels sprouts, cabbage, barley, oat, and corn. Although we probably wouldn't be having corn because of the mycotoxins. Green vegetables and nori and rice bran. So I think, look, it's worth bearing in mind. And in general, it's worth having a wide range of vegetables in your diet for sure, with all the different phytonutrients, unless you cannot tolerate them. Some people, just can't tolerate them because of oxalates and salicylates and so on, and may just need to go on a low vegetable diet for some time, but that's fairly rare. Now, saunas can be quite useful for sweating, as the sauna is thought to excrete mycotoxins, and there is 1 to 2 studies showing that, as it does for heavy metals, pesticides, and other chemicals. So it would be good to see more studies done in this area, but there is definitely at least 1 or 2 which indicate that it is useful. And coffee or chamomile enemas increase bile production, and therefore the amount of mycotoxins and biotoxins the binders can latch onto. So the binders are only going to work if your liver is producing a lot of bile. So coffee or chamomile enemas are useful. There's also a supplement called Tudka, which can be quite useful. And there's also herbs which we call choleretic herbs that also help increase the production of bile. So anti-inflammatory supplements can be useful, such as resveratrol, curcumin, quercetin, green or black tea extracts, omega-3s. Repair supplements include phosphatidylcholine, glutamine. Just be careful that you're not the sort of person who seems to convert it to glutamate. That can happen. So care with glutamine. Zinc carnosine can be very useful for the stomach and the GI tract. And then immune support medication supplements. Low-dose naltrexone can be very useful. NAD used as a nasal spray or as an IV or even a intramuscular injection can be very useful. Glutathione, zinc, magnesium, and vitamin D. So it is very important just to have good nutrition. And particularly if you're showing low in certain nutrients on the organic acid test, it is important to replace those. Okay, ready for the final section now?
Sounds good.
So then finally, we've got a whole body inflammatory response to mold and dampness, which the Shoemaker research team referred to as CIRS. It's also, you could say, mast cell activation is like a variant where specifically the mast cells are causing the inflammation. Now, this tends to be a chronic multi-system and multi-symptom condition, except in young children who may only have 1 symptom, partly because their ability to express symptoms may be limited. Patient often presents with or is diagnosed with ME/CFS, which is chronic fatigue syndrome, or fibromyalgia. They can also present with autoimmune illness such as inflammatory bowel disease, Hashimoto's, etc., multiple sclerosis, Alzheimer's disease, mast cell activation, we've talked about, small intestinal bacterial overgrowth, psychiatric, they may have been diagnosed with psychiatric conditions or be expressing a degree of depression and anxiety, or may have been diagnosed with somaticization, I won't go into. So the screening for this is the visual contrast sensitivity test, which you can do handheld or online at survivingmold.com, as well as a range of different blood tests, such as leptin, VIP, copeptin, etc. So they're kind of they're important tests, And then we've got the HLA-DR-DQ test for screening. So you can do that via LabCorp in the United States or Sonic Health in Australia. And there is a website where you can put your results into to get an idea of what your result is. And doing a mold sabbatical is another really good screening tool. So for instance, just taking a 1 to 2 week break, like camping is the most preferred thing from your current home, and taking as little from home as possible. I mean, the big thing is you don't want to take contaminated items. You want freshly washed clothes. And if you take some electronics, you want to take as little electronics as possible. They all need to be properly HEPA vacuumed and damp wiped before you go. And yeah, take some time out in nature and just observe what happens. So then we've got the C3, C3A, C4A, TGF beta 1, MSH, etc. So that can be done via LabCorp and Quest in the United States. And the Genie test can be done via Dr. Shoemaker's lab. And then we've also got volumetric MRI or NeuroQuant, which there's various. If you go to cortexlabs.com, there is a list of different imaging companies in the United States and worldwide. Urinary mycotoxins is readily available through functional medicine practitioners, as is the serum mycotoxin antibodies and the organic acid test. The Marcon's nasal swab, well, the nasal swab is not just for Marcon's, which is one organism that may show up. Nasal swab is generally widely available, again, through functional medicine practitioners, and you want to send it through to microbiology DX. That's the one. That's the lab that culture the test for long enough. Again, we keep going back to this, but it is the key. You've got to get away from water damaged locations. So remediation or relocation is generally the name of the game. I mean, there's various other options that we're looking into, but none of them are looking reliable at this point. So getting an inspection done is a very important part if you're unwell from any type of mold, actually, and any type of mold-related illness. So looking for visible water damage or mold growth is very important. Looking for musty smells and malodor. So if they're present, you can pretty much bet your bottom dollar that you've got water damage. But even if they're not present, getting at minimum a PCR test done, which is the ERMI or HERTSMI test, or inspection by an indoor environmental professional. That's the gold standard. Now, in my course, we talk a lot about what questions to ask an indoor environmental professional to make sure they're properly qualified. We want to make sure that they are people who understand CIRS and MCAS and other chronic conditions related to mold and dampness, and they're not just dealing with mold at a superficial level. So if you talk to them and they say that they generally just go and spray mold and wipe it off or paint over it, you want to run. You want to find people who know how to identify the source of moisture in a building and properly give a scope of work for remediation or recommend alternative housing if remediation is not possible. So ideally, finding a remediator who's separate from the inspector is a good idea. And ideally, they're IICRC certified using the IICRC S520 standard for remediation of water damaged buildings. As we said, ideally different from the IEP. There's also a good list of inspectors and remediators at ISEAI.org, which we call ICI, International Society for Environmentally Acquired Illness. Okay, getting towards the end here. So there's a range of different binders, as we mentioned, for mycotoxicosis. But one of the unique treatments for whole body inflammation is we use something called VIP nasal spray, which tends to help with inflammation and increase immune modulation. And also synapsin nasal spray can be quite helpful to increase neurogenesis and reduce inflammation. And then various supplements are often used, such as resveratrol, curcumin, CBD, melatonin, NAC or glutathione, and phosphatidylcholine. So this is probably getting a little bit technical, but just to recap, mycotoxicosis can be single or multi-system, and it's often gut And there's often a neurological component in there as well, while the inflammatory response is almost always multi-system and tends to be more severe and disabling. The testing again is different. So urinary mycotoxin or serum mycotoxin testing for mycotoxicosis, while it's the more extensive testing for CIRS, such as the inflammatory biomarkers, hormones and antibodies in the blood, and neuroquant. So the treatment is similar in that avoidance of mold is key, binders are key, and inflammation and immune balancing. But in CIRS, there's more immune balancing and inflammation that takes place. More neurological and cell membrane repair needs to take place, as well as limbic retraining and vagus nerve stimulation is some of the newer treatments that are found to be helpful. And generally, it takes a little longer to achieve recovery from CIRS. So that's a bit of a quick introduction to the different forms of mold illness, and I hope that's been helpful and not too overwhelming.
That was a fantastic. That was probably one of the best presentations I've seen that lay out really the vast array of ways that people can be impacted by mold and water damage buildings. Because I think one of the things that questions we get usually from spouses who are a little reluctant to believe that their home or their indoor environment is making their loved ones sick. They'll say, well, if it were mold, we would all be sick in the same way. And that's just not the case. Tell us a little bit, just briefly, because I know we're over time. Why is it that mold affects people in the same home differently?
Yeah, so everyone has their unique genetics and basically just their unique physiology. In other words, their body has different strengths and weaknesses, you could say. And so some people, like I once looked after, I think it was around 10 people who were in a men's clothing store in Australia, which had a massive mold problem. And they were all affected differently. For some reason, women tend to be affected more. We still don't know why, but that seems to be the case. But those who have certain genetic weaknesses, it could be HLA or it could be related to various other genes such as ABCC or there's a range of other ones that Bob Miller's software can find. That if there's a weakness somewhere in the excretion pathway, or there's a weakness regarding mast cells or oxalates, there can be a tendency to get some form of mold illness in a very severe way, while other people may just get the very basic kind of colonization symptoms and allergy symptoms. So everyone who's been in a massive mold infested building will have some symptoms, generally speaking, but it's quite easy to kind of just ignore, some some mild symptoms such as a runny nose or a sore throat as just being normal, or I've just got a cold. But when people have severe debilitating illness, it's very important that they don't get ignored, that they're properly identified as having been affected by a water damage building, and that they get proper treatment and diagnosis.
Yeah, I want to touch on that last point real quick before we wrap up, because I really appreciate how you touched at the very beginning about how overlooked this is, how dismissed it is, because I know for a lot of people, you might be having multiple symptoms. You're not connecting the dots, right? Oh, my headaches are not related to my GI issues. That's not related to my fatigue. I'm just getting older. I'm a mom. I have kids. I'm tired. And so I really appreciate how you put emphasis on believing the patients, and hopefully, and this is one of the things we're trying to do at the foundation, we start to shorten the time it takes for healthcare practitioners to ask those questions when they have a patient, tell me about your home. Because it's a very overlooked factor, and it's something we can control. And, by fixing that, hopefully improve the body as well. So I guess one of my just last questions, because I know we're over here. If someone is going to their doctor and they're having these symptoms and they want to have this ruled out, what should they say to their doctor? What should they ask for?
That's a good question. Now, if it's a general practitioner, it's going to be somewhat hard, because many of those tests we've discussed today will not be within the radar of the general practitioner, but you could ask to have some of those those simple ones done, such as VIP and leptin. In the US, my understanding is even a general practitioner could theoretically just write out the tests on a LabCorp or request form for the C4A and TGF-beta, etc. Like, you don't need a special form or anything like that, but you may have to take in the test codes for them. And so I guess if you've got that information, that's available on survivingmold.com, the test codes and which of the tests should be done with Quest and which from LabCorp. Even if you can just all get them all done with LabCorp, it's still reasonable to do so. So that's probably going to be the first, the first and easiest line of approach, I would think, is that there are these tests available, and would they be willing to have them done? Because there's a research team. There's various research teams around the world who are looking at this particular inflammatory illness, and it's got unique inflammatory markers. So it's worth telling them that in this condition, the standard SED rate and CRP are not going to be elevated. So we need to go beyond that and do more markers. I think by all means that the general practitioner should still do their standard screening for connective tissue and autoimmune disease. I still think that should be done. You should exclude that you've got one of those conditions. But in addition, if they're willing to do those additional blood tests, for instance, such as the C4A and TGF-beta and MMP9, that's going to be really useful. And the reference ranges are on the Surviving Mold website. So some of them are not the same as the ranges that Quest and LabCorp will give you. And so if you can get those reference ranges and go through the results with your doc, hopefully your insurance will cover some of it. And that'll be a great place to start, because if you've got those biomarkers elevated or abnormal, rather, some of them are actually lowered, then you know that you're in this domain. I mean, it doesn't 100% tell you that mold is your problem, but it tells you that you're in this domain of biotoxin related illness. So then you can look at going to a functional medicine practitioner who is literate with mold related illness, or it could be a specific Shoemaker trained physician, whichever way you decide to go, and get more in-depth diagnosis and management. But then the other way to go at the same time probably would be then to look at getting your house properly inspected at the same time, because you can't neglect that part. And you could say just doing that's the other pathway, that even if you don't go down the pathway of doing the blood tests and whatever, just going down the pathway of having your home inspected and finding out, is there a major mold problem? And then I guess you could say there's always the issue of knowing, is there a direct connection with the home and your symptoms? And one of the simple ways of doing that, particularly if you haven't really got a medical team who are supporting you, is to go and do a mold sabbatical. Just get out of the place for a good period of time and see if things start to settle.
Yeah, we absolutely see that people will go on vacation or out of town, or a teacher, maybe they have the summer off and they feel better, and it's almost like an accidental sabbatical, and they're like, oh, yeah, I feel better. And then they go home again, or they go back to their office and they're like, well, now I feel worse. And that's a clue. You're absolutely right.
Yeah. So those are some of the things you can do. Look, there's various pathways. Sometimes it may mean going and just going straight to a functional medicine practitioner and starting to get some of those other tests done, like the mycotoxin tests, or rather than going through the standard doctor. You just got to find what path is going to be right for you. And find the path of least resistance, if you like, that can help you to move along this journey. And ideally doing a course is a great idea. And doing summits like this can really help you, inform you. There's various online courses now. When I released mine, I believe there wasn't any other ones, but now there's about 12, I believe. So there's a whole range of courses you can have a look at. You can find mine at moldillnessmadesimple.com, which is spelled the American way, MOLD. It's really important to become literate with the condition overall, so you can become your greatest advocate. Otherwise, you just get thrown around by different practitioners and different people on forums with whatever idea they come up with on the day. But if you have a good theoretical understanding of the condition, you can guide yourself through recovery. And it's definitely possible to recover. So don't lose hope, hang in there, and know that it is possible.